Welcome to the Podiatry Profits Podcast, where you will discover how to get more patients and multiply the profits of your practice with minimally invasive foot surgery, proven marketing systems, and ethical influencing to your patients. And now, your host, board-certified podiatrist, best-selling author, speaker, and founder of TJ Ahn Coaching and Consulting, Dr. TJ Ahn.
Hello, this is Dr. TJ Ahn. Welcome to this special interview section. So my guest here tonight is, again, I said very special because he is also one of my mentors. And I met him when I was a student at Scholl. And ever since then, he's been so much supportive in for my own practice, my consulting business, and also he consistently help our profession, podiatrist profession, and I see from like firsthand experience. And I want to introduce Dr. Sev Hrywnak. He is visiting professor at Columbia University at Department of Economics. And he is also Northwestern School of Medicine as a clinical professor. He was a former assistant professor at Scholl College of Podiatry Medicine. So it's very interesting. That's a formal introduction, but I know he's a podiatrist, MD, and also he's an attorney, and he owns multiple businesses, I know, and he owns a surgery center here in Chicago region. So without further ado, again, I'd like to introduce Dr. Sev Hrywnak. Hello, Dr. Hrywnak.
Dr. Ahn, how are you? Thank you for having me on.
Yeah, it's kind of strange to have you on the interview because I see you regularly in person because we both have businesses in Chicago area. Reason why I brought you here is that you are known as a medical futurist, and you've been predicting a lot of things you have told me personally and in public kind of came to be true, you know. And I listened to your advice several years ago, and I've adapted. And then I've prepared and transformed my practice, and I cannot be happier where I am right now. And I'd like you to kind of share your views and your suggestions and advices for our profession, not only starting podiatrist, but also it could be students who are in the podiatry school, or who could be in the residency training, or who could be savvy podiatrist, veteran podiatrist who's been working for many years already. And I believe they need to know what's going on. So having said that, would you tell me about overall, healthcare trend, again, what you are seeing now, and then what could be happening near in the future?
Well, currently we're in a revenue transition period for all of medicine, but I'll concentrate more on podiatry. And when I say that we're in a revenue transition period, I'm talking about the transition and change from a fee-for-service reimbursement to a value-based reimbursement. Along with that, bundled payments coming down the road here. There'll be a lot of changes in the next 5 years, starting in 2021, regarding reimbursement for physicians. And I think it's important that the physicians today realize the changes that are coming tomorrow and be prepared for them.
Mm-hmm. What do you think about this whole trend of, along with that, the office-based surgery versus, big institution like hospital type of surgery?
Well, again, the insurance companies pretty much dictate the course of where reimbursements go. They have a strong lobby in Washington. They pretty much dictate to everybody else what's going to be paid, what's not going to be paid. And the realization is that Medicare, if we talk about Medicare, the Medicare trust fund is dwindling down. They say it's going to be near pennies by 2025, 2026. and physicians are going to have to make an adjustment in how they practice. My basic philosophy in looking forward, we started doing these analysis back in 2011, 2012, over a 10-year span. And most of what we looked at from an economic standpoint for the next 10 years is coming to fruition. A lot of cases are moving to the outpatient site. Now, either it's a surgery center or even thus more further would be to an office-based setting. That's already been proven by gastroenterology doing more procedures in the office, interventional radiologists doing more procedures in their office, and they're already been structured in a bundled payment format to receive funds at a greater scale than if they did the procedure in a hospital or even at a surgery center. So when we take a look at the changes coming forward, you have to take into account that the amount of money that's been made available as the aging population grows older, the amount of money to be paid for procedures, the hospitals, again, are charging 7 to 12 times the normal rate, Medicare rate, for an operating room. And again, by doing the forecast down the road here, to pay for a foot surgery, $30,000, $40,000 for an operating room is cost prohibitive now going forward. That's why the incentives are being put in place. That's why a lot of procedures are being driven to the surgery center or to the office procedure. An example being here in Illinois, Blue Cross and Blue Shield just recently sent letters out to a lot of providers stating that if you bring a procedure to the hospital, be it outpatient or inpatient at the hospital, they're going to deduct 15% from your professional component. But at the same time, if you take that procedure to a surgery center or do the procedure in your office, you'll receive a 15% bonus. And this is the pathway that they're going to start getting bundled payments for everybody. And again, what I mean by bundled payments is if you do the procedure in your office, there'll be a single check sent to you that'll include your office-based facility, supplies that you would need, the anesthesia, and your professional component. That's already been set into place. The only minor changes that need to be done is there are going to be adjustments in Stark law probably the next year, in the next 12 months, because right now, as physicians, we're prohibited to give checks or splitting a fee. So for bundled payments to work, they're going to have to change a little bit of the Stark law where you might get a check, and I'm making a round number here, for $5,000, but you might need to cut a check to the anesthesiology group that came to your office to provide anesthesia services. And that's the trend that's going. And there's no turning back from this. And you'll see a lot more specialists doing procedures in their office. I was at a conference a year ago where the orthopedic group was training the orthopedic surgeons to do knee scopes in their office. And they're actually telling them how to set it up for an office-based procedure. So again, this is just the tip of the iceberg, but this is what's coming down the road.
Mm-hmm. Thanks for sharing this information. I know you've been talking about this already for, past 3-4 years. And it's again, coming to be the true and reality. And, I work with a lot of podiatrists in my consulting side and mentorship program. The mindset of podiatrists still, it's a very difficult to shift, because a lot of podiatrists still think their podiatry practice as more fee for service, CPT codes and diagnosis codes. And now, because of these bundled payments, what would you suggest, advise podiatrists, perhaps in terms of more mindset, looking at as to this reality of healthcare trend?
Basically, it comes down to the old adage that time is money. And if you're generating an income by being in your office, and the average podiatric physician, the hourly rate set back in 2019 on the average was $470 per hour. So for a doctor of podiatric medicine staying in their office, you're averaging about $470 per hour. Why would you leave your office and get in the car and drive across town to a hospital and wait to do a procedure and then drive back? All right, that's not being cost effective. If time is money, then you shouldn't be leaving your office. That's going to be a major driving force going forward. As doctors realize, I can do this procedure here, not lose any time, still provide excellent care for my patient, and not get caught up into the old stereotypical hospital setting where I need to be in a hospital to have anything performed. And again, we can talk about vendor-driven procedures, which is a separate topic, that the vendors who want to give you special plates and screws, et cetera, and you have to do the procedure in the hospital, that's a different story. Just by looking at the mere fact that time is money, and if you leave your office, you're in the negative. So why would you go into a negative economic status when you can still be positive by driving income for yourself by staying in your office? And I'm not just talking about procedures. You can see patients in the meantime. What helps you is also the anesthesiologists or nurse anesthetists, which are now called nurse anesthesiologists, will come and provide the anesthesia for you. So there's really no reason to leave the office. In fact, not only will they do anesthesia for you, but some of the anesthesia companies will bring hardware and bring power equipment if you need it, depending on the type of surgical procedure you choose. So it's time that you took a good look at what is going on in the next 4 to 5 years. And if you're a student, you should be reading medical economics. If you're a resident, you should follow the doctors around, see which ones are hanging around the hospital versus the ones that maybe do a procedure and run back to their office. They know that they're losing money by hanging around. And again, slowly and surely, as the ophthalmologists did in the 1980s, they slowly got away from the hospital. As other groups slowly got away from the hospital, they are realizing they're capturing those dollars by leaving their office.
Mm-hmm. Can you share your thoughts about, I don't know if it's across the United States or not, but that, now that nurse doctor and PA doctor and how they can influence our podiatry profession?
That's an interesting question. Mid-level providers, physician assistants, nurse practitioners, doctors of nurse practitioners, again, that's being fueled by the insurance industry. Everybody knows there's a need for primary care. There's a need for more physicians. And the insurance companies found out years ago that the physician assistant or the nurse practitioner fills that void. So instead of waiting 7, 8, 12 years for a doctor to graduate residency, they can get the mid-level providers. And I shouldn't really be using the word mid-level provider, but the nurse practitioners, the PAs can fill a lot of those positions. Now, if we talk about healthcare changes going forward, doing population health management, you have to be able to do things from head to toe and be all-inclusive if you're a healthcare provider. That's why it's very important for podiatry, and as you know, I'm a very big proponent that it's time for podiatry to have a full license from head to toe in order for us to fit into population management. And I'll always use the example that if a patient had a diabetic ulcer subsecond medahead, and the patient went to the podiatric physician, of course the podiatric physician can debride that diabetic ulcer subsecond. So could a nurse practitioner, so could a physician assistant. The difference being the physician assistant nurse practitioner can also adjust their blood pressure medicine, can also adjust their insulin dosage, where the podiatrist can't. But from an academic standpoint, they've learned all this in their medical education. Why not use it? So there's a gap that needs to be fulfilled in letting the podiatrist have a full license. It would help the patients. It would help patient population management. And would also help increase the number of applicants to the podiatric medical colleges.
Yeah, I'm totally with you on that. And I'm a big proponent of your idea of full licensure as a podiatry. But what are the roadblocks to get there? What's holding us back to advance to that, new era of podiatry as a full licensed physician?
To put it kindly, it's more of podiatric politics, right? Because in Illinois here, from a Illinois State Medical Society viewpoint, from a legislative viewpoint, once you present them the argument of the equivalence of the education the MDs, DOs, and DPMs have, it's really no question. The full license should be there. It just, when we get into the podiatry aspect of it, the politics seems to be something that's at times insurmountable. I wouldn't say impossible, difficult, but not impossible.
I know you're still trying, right?
Still trying.
Yeah.
I will keep always trying.
Yeah, for example, I think you've offered the full HMP workshop, etc. Do you still do that?
We still do that. We haven't done it this year because of the pandemic, but at least twice a year we do a certification in history and physical examination. Correct.
And I'd like to ask you kind of last question, like we're going through this pandemic and post-pandemic and going through this whole election turmoil of political battle affecting United States economy and economic hit to our profession and many other small business owners. I know it's maybe a difficult question to ask, but what are you predicting? Like, when do you think it's going to kind of stabilize and, one or the other direction, and then we can finally focus on, helping patients and then go through just our typical struggle. We have enough struggle with insurance companies on its own. And then now on top of it, a lot of doctors are struggling. So what would you say about those?
Well, an off-the-cuff remark would be things will probably change a lot after January 20th, 2021. Yeah. But in a more of an economic viewpoint, if a stimulus package is signed again, that would be a big, enormous boost to the economy. You need people to get back to work. When people are at work, they get insurance. When they have insurance, they can go see the physician and take their pathologies taken care of. So it is a domino effect, but somebody's got to push the first domino. So my feeling is that within the next 90 to 120 days, I believe a lot of things will change.
Next 100, yeah. So January 20, I cannot wait. I cannot wait. Just get it done with this whole COVID pandemic. And do you think a vaccine will be more, like, in your opinion, it'll be more kind of public and people will get vaccinated soon?
I would hope they would get vaccinated. But you got to look at the converse, meaning that I'm saying within the next 90 to 120 days, things will get better. But let's take, for example, things don't get better. All right. You still have to approach your business. All right. I don't care if you're solo or in a large group, small group, you still have to take care of business, and your business is taking care of patients. So you still have to find that avenue, even though, say, we're still deep in the pandemic, patients still need care, and you're going to have to find innovative ways to make sure you take care of that patient. Telemedicine changed everything last 6 months, but ways that you can see the patient either in your office or have a vehicle or a way to get to their homes, wherever they're at, to see them if the pandemic is still at a critical point. So again, you always look at the bright side and always look at the not so bright side, because your business still has to go on and the care of patients still has to go forward.
Any last comment about maybe anything, any topic you want to talk to a podiatrist this interview?
Oh, I do believe that if you had to talk about one certain thing that would definitely help you from an economic standpoint, is develop the idea to do office-based surgery. And again, if you're asking me my personal opinion of technique, from what I've witnessed with your group, been lecturing at your group and seeing what's going on, I think minimal incision surgery, not just for podiatry, but I know it's being used by neurosurgeons, orthopedic surgeons. Minimal invasive surgery has caught on in the last couple of years. So I would strongly recommend that if you're not trained in minimal invasive foot and ankle surgery, now's your chance to get the training, learn to set up your office. And again, people question if you need a license to have a surgical suite or a certificate of need. The answer is no, you don't need that. Get the correct training, get confident in your skills, and your business should thrive if you do minimal invasive office-based foot and ankle surgery.
100%. So across the states, as far as you know, they don't need a special like licensure or accreditation to run office-based surgery.
At this time, there aren't any specifications, any specifics needed to do office-based surgery. If you have an office, you can do surgery in it. That's what's going on now. Now, a surgery center, again, the rules are you need a certificate of need, have the states. Not all states need a certificate of need. So,
happy Thanksgiving to everybody.
Sorry.
That's okay.
So again, not all states require a certificate of need. Some do, some don't. But as far as office-based procedures go, right now there aren't any restrictions.
Beautiful. If anybody wants to kind of get further information or connect with you, is it okay if I share perhaps your like email address or something like that?
Of course, it's fine. Absolutely.
Thank you so much, Dr. Hrywnak. So this concludes the interview with Dr. Sev Hrywnak about economic benefits of office-based surgery, minimally invasive surgery, and kind of future of podiatric profession in 2021 and beyond. Again, thank you so much for listening in or watching this video segment, and I'm looking forward to connecting with you very soon. Thank you.
Thank you, Dr. Ahn. Thanks for having me on. Appreciate it.
Thank you.
You've been listening to the Podiatry Profits Podcast with Dr. TJ Ahn. To find out more about Dr. TJ Ahn or discover how you can grow your podiatry practice, visit drtjahn.com, or you can also get a free copy of Dr. Ahn's best-selling book, Opt Out: How to Take Back Financial Control of Your Private Clinical Practice Without the Hassle of Insurance Companies. Just go to optoutbook.com.